Neuropathy revealed. The invisible enemy that may be destroying your nerves. Have you ever felt unexplained tingling in the extremities of your body? What if these seemingly harmless symptoms were signs of a much more serious problem? Did you know that millions of Americans suffer from nerve damage without even knowing the real cause? Imagine waking up every morning with sharp pains, numbness, or a burning sensation in your hands and feet without understanding what is happening to your body. Neuropathy is a devastating condition that affects the peripheral nervous system, causing damage that can be irreversible if not treated properly. The medications you take daily may be silently damaging your nerves without you realizing it. The scariest thing is that often doctors just treat the symptoms, ignoring the true causes that may be related to common medications or environmental toxins. This is a conversation we need to have now, because the right information can be the difference between ongoing suffering and effective recovery. Let's get started. A. The shocking truth. Neuropathy is quietly affecting millions of Americans. Peripheral neuropathy is not just a health problem. It is a silent epidemic that is affecting more than 20 million Americans. Many people associate this condition only with diabetes, but this is just the tip of the iceberg. The reality is that neuropathy can affect anyone, regardless of age or pre-existing medical condition. Peripheral nerves form a complex network that extends from the central nervous system to the extremities of the body. These delicate nerves are responsible for transmitting sensory and motor information that is essential for our daily functioning. When damaged, the impact can be devastating to all areas of life, from basic activities to the ability to work and relate. Neuropathy is often underestimated by healthcare professionals, leaving millions of people suffering needlessly without proper diagnosis. Recent studies from the University of Rochester reveal that nearly 60% of neuropathy cases are initially misdiagnosed. Many patients spend years going from doctor to doctor, trying to understand what's going on with their body. The American healthcare system often fails to recognize the underlying causes, leading to frustrating diagnoses of idiopathic neuropathy. This medical term simply means that doctors don't know what's causing your symptoms, an unacceptable response these days. The truth is that there is much more information available than most doctors share with their patients, and what you'll discover next can completely change your understanding of this debilitating condition. Have you ever wondered why so many people are developing nervous problems, even when their other medical conditions are under control? 2. The warning signs. Your body is sending. Are you paying attention? The symptoms of peripheral neuropathy are like alarms that your body activates when something is wrong with your nerves. Burning pain is often the first sign, especially at night when you're trying to rest. Persistent tingling in the hands and feet may seem harmless initially, but they are important signs that should not be ignored. The sensation of walking on cotton or having invisible socks on your feet is a classic symptom reported by many patients. Progressive muscle weakness can develop, making simple tasks like opening a bottle or climbing stairs increasingly difficult. Hypersensitivity to touch is another telltale sign, when even the weight of a sheet on your feet can cause extreme discomfort. Many patients describe the sensation as if they are being attacked by invisible needles, a daily torture that few fully understand. Loss of balance and coordination significantly increases the risk of falls, especially among older adults with neuropathy. Changes in body temperature, such as feeling constantly cold or hot, feet are often overlooked as symptoms of neuropathy. Progressive numbness can lead to loss of sensation, increasing the risk of injuries that go unnoticed. In advanced cases, patients can develop foot ulcers that do not heal, which can lead to serious complications such as infections. Early detection of these signs can be the difference between effective treatment and permanent nerve damage. What makes these symptoms particularly insidious is that they often progress slowly, allowing you to adapt without realizing how much worse you're getting. Do you know someone with these symptoms who remains without a proper diagnosis? 3. The medications in your cupboard that are secretly attacking your nerves. Surprisingly, many medications prescribed by doctors to treat health conditions may be the culprits for neuropathy themselves. Amiodarone, often prescribed for heart problems, has been linked to significant nerve damage in recent clinical studies. Fluoroquinolone class antibiotics, such as ciprofloxacin and levofloxacin, are known to cause peripheral neuropathy in thousands of patients. Chemotherapy drugs, such as bortezomib and vincristine, directly affect nerve fibers as a side effect of cancer treatment. Statins, used by millions of Americans to control cholesterol, can cause nerve damage that persists even after stopping the drug. Colchicine, commonly prescribed for gout, has been linked to neuropathy when used for prolonged periods or in high doses. Most alarmingly, many doctors continue to prescribe these drugs without adequately informing patients about the risks of nerve damage. Tumor necrosis factor inhibitors, used for autoimmune diseases such as rheumatoid arthritis, can trigger neuropathy in susceptible patients. Disulfiram, prescribed for alcohol dependence, has well-documented neurotoxic effects that many patients are completely unaware of. Even pyridoxine, vitamin B6, when taken in excess, can paradoxically cause nerve damage instead of preventing it. Antiretroviral drugs for HIV, such as stavudine and didenosine, pose a dilemma for patients who have to choose between controlling the virus and protecting their nerves. Nitrofurantoin, often prescribed for urinary tract infections, causes neuropathy on prolonged or repeated treatments. If you are taking any of these medications and experiencing symptoms of neuropathy, it is crucial to discuss alternatives with your doctor immediately. What if I told you that there are equally dangerous toxins that you may be encountering every day without even knowing it? 4. Hidden poisons, the environmental toxins that are harming your nervous system. In addition to medications, we are constantly exposed to environmental toxins that can silently damage our peripheral nervous system. Arsenic, found in some foods, contaminated water, and even wood treatment products, is a potent neurotoxicant. Occupational exposure to industrial solvents, such as trichloroethylene, can cause severe neuropathy in unprepared workers without adequate protective equipment. Heavy metals such as lead and mercury remain significant threats to neural health, especially in industrial areas or in older homes. Many U.S. veterans developed neuropathy after exposure to Agent Orange during military service, a toxic legacy that persists decades later. Pesticides and herbicides, particularly organophosphates, pose significant risks to agricultural workers and rural communities. The tragedy is that many people suffer nerve damage for years without ever identifying the environmental toxins responsible for their debilitating condition. Paints, varnishes, and other household chemicals contain neurotoxic compounds that can be absorbed through the skin or inhaled during use. Some unregulated nutritional supplements may contain contaminants such as lead or mercury that progressively damage the nervous system. Occupational exposure to ethylene oxide, used in medical sterilization, has been linked to severe cases of peripheral neuropathy. Thallium, found in some rodicides and industrial pollution, is particularly dangerous for its ability to mimic potassium in the body. These toxins can enter your body through a variety of routes, including ingestion, inhalation, and even skin absorption. Detection of these exposures often requires specialized tests that many physicians do not routinely order. Knowledge of these sources of toxicity may be the key to finally discovering the cause of unexplained symptoms that have persisted for years. Have you ever considered how neuropathy is affecting not only your health, but every aspect of your daily life? 5. The daily devastation. How neuropathy is robbing you of your quality of life. Neuropathy is not just a medical condition, it is a thief that steals precious moments and everyday experiences that many take for granted. Chronic sleep disturbances are common among patients with neuropathy, with intensified night pains making rest nearly impossible. Reduced mobility leads many people to abandon activities they once loved, from hiking to dancing with their loved ones. The psychological impact of chronic pain is devastating, with rates of depression 3 times higher among people suffering from neuropathy. Intimate relationships often suffer when neuropathy affects sexual function, an aspect rarely discussed by health professionals. The inability to properly feel your feet can turn simple activities like driving into dangerous challenges. Neuropathy not only causes physical pain, but it also creates deep emotional distress that can completely isolate people from their social lives. Many patients report feelings of shame when they have to cancel plans repeatedly due to the unpredictability of symptoms. Decreased manual dexterity can make simple tasks like buttoning a shirt or typing text frustrating and time-consuming. Lost independence leads many to rely on caregivers, a psychologically challenging transition for previously autonomous adults. The financial impact of neuropathy is substantial, with elevated medical costs and possible loss of income due to the inability to work. Extreme sensitivity to touch can make even hugs from loved ones painful, depriving patients of physical comfort when they need it most. If you are experiencing any of these impacts, know that there is hope through a better understanding of the underlying causes. Did you know that the relationship between diabetes and neuropathy is only one part of a much larger story? 6. Beyond diabetes, the surprising connection your doctor may not be telling you. While diabetes is often cited as the leading cause of neuropathy, this is just one piece of a much more complex puzzle. Up to 60% of diabetics will develop some form of neuropathy, but glycemic control alone may not completely prevent the condition. Many diabetics with excellent glycemic control still develop neuropathy due to unidentified medications and toxins in their lives. Chronic inflammation, present in many conditions besides diabetes, can trigger and perpetuate damage to peripheral nerve fibers. Autoimmune disorders such as lupus, rheumatoid arthritis, and Sjogren's syndrome often cause neuropathy through inflammatory mechanisms. Nutritional deficiencies, particularly of vitamins B1, B6, B12, and E, can cause or aggravate nerve damage even in non-diabetics. The approach of treating only diabetes while ignoring other root causes is like trying to empty a leaky boat without fixing all the holes. Rare genetic disorders like Charcot-Marie-Tooth disease affect tens of thousands of Americans, often misdiagnosed for years. Vascular problems that compromise blood supply to the nerves can cause ischemic neuropathy even with normal glucose levels. Infections such as shingles, Lyme disease, and HIV can leave persistent nerve damage long after successful treatment of the original infection. Hormonal imbalances, especially thyroid-related, can trigger neuropathic symptoms that are often attributed to other causes. Mitochondrial dysfunction, increasingly recognized as a central factor in many diseases, contributes significantly to nerve degeneration. Understanding these broader connections is essential for truly effective treatment that goes beyond simply controlling symptoms. But what can you do today to protect your nerves from future damage? 7. The protective shield. Proven strategies to shield your nerves. Protecting your nerves starts with a thorough evaluation of all the medications you're currently taking with your doctor. Replace toxic household chemicals with safer, more natural alternatives whenever possible to reduce your total exposure. Invest in high-quality water filters to eliminate contaminants such as arsenic, lead, and other heavy metals from your drinking water. Choose organic foods when possible to minimize exposure to neurotoxic pesticides present in conventional products. Maintain stable blood glucose levels through a balanced diet and regular exercise, even if you are not diabetic. Limit alcohol consumption, as even moderate amounts can contribute to nerve damage over time. Proactive prevention of neuropathy requires a thorough approach that addresses multiple risk factors simultaneously, not just a single aspect. Wear appropriate protective gear if your job involves exposure to industrial chemicals or other neurotoxicants. Practice stress management techniques like meditation and yoga, as chronic stress can exacerbate systemic inflammation. Maintain a healthy weight, as obesity is associated with chronic inflammation that can damage peripheral nerves. Avoid smoking and exposure to secondhand smoke, as nicotine compromises blood circulation to the peripheral nerves. Talk to your doctor about safer alternatives if you're taking medications known to cause neuropathy. Get regular checkups to monitor for nutritional deficiencies that can contribute to nerve problems. These preventative strategies can make a significant difference in the health of your nervous system in the long run. Did you know that certain nutrients can not only prevent but potentially help repair damaged nerves? 8. The power of nature. Supplements and nutrients that can regenerate your nerves. Nature offers powerful compounds that can support neural health and regeneration when properly incorporated into your daily routine. Alpha-lipoic acid is a potent antioxidant that has been shown to significantly reduce symptoms of neuropathy in several clinical studies. Benfotiamine, a fat-soluble form of vitamin B1, penetrates nerve cells more efficiently than conventional forms of thiamine. Gamma-linolenic acid, found in evening primrose oil, has demonstrated substantial benefits for patients with diabetic neuropathy in recent research. Acetyl L-carnitine helps improve mitochondrial function and may promote the regeneration of small nerve fibers. Curcumin, the active compound in turmeric, has powerful anti-inflammatory properties that can reduce neuropathic pain. The right nutrients, in the right doses, can create the ideal biochemical environment for damaged nerves to initiate their own natural repair processes. Magnesium plays a crucial role in nerve and muscle function, with deficiencies often seen in patients with neuropathy. Omega-3 fatty acids reduce systemic inflammation and help maintain the integrity of nerve cell membranes. Vitamin D is essential for neural health, with deficiencies linked to greater intensity of neuropathic pain. Vitamin E protects cell membranes from oxidative damage, which is particularly important for lipid-rich nerve cells. The complete B complex works synergistically to maintain nerve health and is most effective when taken together rather than isolated B vitamins. Always consult a healthcare professional before beginning any supplementation regimen, as some may interact with existing medications. Proper supplementation can complement other therapeutic approaches, offering relief where conventional treatments have failed. What if you could find relief through methods that no longer involve medications? 9. Transformative relief. Exercises and therapies that are revolutionizing treatment. Non-pharmacological approaches are gaining significant recognition as essential components in the effective management of neuropathy. Low-impact exercises like swimming and Tai Chi improve circulation to the peripheral nerves without additional stress on the joints. Acupuncture has shown promising results in clinical studies, with many patients reporting significant reduction in neuropathic pain. Electrical stimulation techniques such as TENS, transcutaneous electrical nerve stimulation, can interrupt pain signals and provide temporary relief. Mirror therapy, initially developed for phantom pain, shows encouraging results for certain types of neuropathy. Specialized massages can improve circulation and reduce muscle tension that often accompanies and aggravates neuropathic pain. Patients who combine multiple non-pharmacologic therapeutic approaches often experience more significant improvements than those who rely solely on medications. Low-level laser therapy has been shown to promote nerve regeneration and reduce inflammation in preliminary studies. Biofeedback techniques allow patients to gain greater control over their physical responses to pain by reducing the intensity of symptoms. Cognitive behavioral therapy helps develop more effective coping strategies for living with chronic pain. Specialized orthotics and therapeutic footwear can reduce pressure in sensitive areas and improve balance in patients with neuropathy. Contrast baths, alternating hot and cold water, can stimulate circulation and provide temporary relief from symptoms. These complementary therapies are most effective when incorporated as part of a comprehensive treatment plan under medical supervision. But how do you know when your condition requires immediate medical attention? December when the alarm should sound. Signs that you need expert help immediately. Certain symptoms represent emergencies that require immediate medical evaluation to prevent permanent damage to the nervous system. Sudden or progressively rapid weakness, especially if it affects more than one extremity, may indicate serious conditions such as Guillain-Barré syndrome. Significant loss of sensation that interferes with daily activities or leads to unnoticed injuries requires urgent evaluation. Extreme pain that does not respond to medications or is accompanied by other neurological symptoms may indicate a neuropathic crisis. Changes in bladder or bowel function associated with neuropathic symptoms may signal spinal cord involvement. Non-healing wounds on the feet, especially in diabetics with neuropathy, pose a significant risk of serious infections and possible amputation. Ignoring these warning signs can lead to devastating consequences, including permanent nerve damage that could have been prevented with early intervention. Sudden difficulties with balance or coordination, resulting in frequent falls, require immediate neurological evaluation. Rapid progression of symptoms over days or weeks rather than months or years usually indicates a more aggressive process. Asymmetrical symptoms, affecting only one side of the body, may suggest compressive causes such as herniated discs that require specific treatment. Neuropathy accompanied by changes in vision, hearing, or other senses may indicate systemic conditions that require a complete diagnosis. If your symptoms started immediately after starting a new medication, consult your doctor before continuing treatment. Neurologists who specialize in neuromuscular diseases or peripheral neuropathy offer the most relevant expertise for complex cases. Don't let fear or inconvenience stop you from seeking care that can preserve your nerve function and quality of life. 11. Rewriting your story. Taking control of your neural health. Understanding the true causes of neuropathy is just the first step in a transformational journey to regain control over your health. Become a proactive patient by questioning prescriptions and requesting less neurotoxic alternatives whenever possible. Keep a detailed symptom diary to identify patterns and triggers that may reveal specific causes of your neuropathy. Seek a comprehensive evaluation that includes testing for environmental toxins, nutrient deficiencies, and often overlooked autoimmune conditions. Build a diverse healthcare team that can address all aspects of your condition, from conventional doctors to functional medicine specialists. Connect with supportive communities where you can share experiences and learn from others facing similar challenges. The journey to overcoming neuropathy is not about finding a miracle cure, but about consistently building habits that promote long-term neural health. Prioritize restful sleep, as it is during deep rest that your body carries out essential neural repair processes. Practice anti-inflammatory eating, eliminating processed foods that can aggravate systemic inflammation and worsen symptoms. Celebrate small victories along the way, recognizing incremental improvements as signs that your body is responding positively. Cultivate a resilient mindset that sees neuropathy challenges not as permanent obstacles, but as problems to be solved. Defend yourself in the healthcare system by insisting on proper investigations when doctors try to label your condition as idiopathic without sufficient diagnostic effort. Remember that each person with neuropathy has a unique story, and your path to recovery will be as individual as your specific circumstances. Now that you're armed with knowledge, it's time to turn information into concrete action. You don't have to accept a life limited by neuropathy as your ultimate destination. Modern science, combined with ancient wisdom about neural health, offers more options than ever before for those suffering from nerve damage. Every step you take to identify and eliminate neurotoxins in your life is an investment in a future with less pain and more vitality. Peripheral nerves have a remarkable capacity for regeneration when we provide the ideal biochemical and physical environment for their repair. The knowledge you've acquired today isn't just information, it's transformative power to reclaim your health and well-being. Always remember, you deserve doctors who deeply investigate the causes of your pain, not just those who prescribe medications to mask symptoms. Your body has an innate wisdom and extraordinary ability to heal when we remove obstacles and provide the necessary resources. The journey may not be easy, but every small step towards neural health is a victory worth celebrating. You possess the power to transform your experience with neuropathy through informed choices and consistent actions every day. Thousands of patients have already rewritten their pain stories to stories of recovery and hope. Now it is your turn to apply this knowledge and begin your own healing journey. Life beyond neuropathy isn't just possible. With the right tools, it's at your fingertips. Take the first step today and know that you are not alone in this journey to regain your neural health and quality of life. With each new scientific discovery, more therapeutic options and diagnostic methods emerge to identify the causes of neuropathy. Your body is constantly seeking balance and healing, and with the proper support, this natural ability can be enhanced. The medical community is slowly waking up to the importance of investigating environmental and drug causes of neuropathy. Informed patients are leading this revolution in therapeutic approach, requiring more thorough investigations and personalized treatments. Your story of recovery can inspire others who are still at the beginning of this challenging journey. Neuropathy doesn't have to define your future or limit your dreams and aspirations. With every toxin eliminated and every nutrient added, you're creating the ideal conditions for your nerves to regenerate. The path to neural health is a marathon, not a sprint, and every small step counts on that journey. Your body is incredibly resilient, capable of amazing recovery when it gets what it needs and is protected from what harms it. True healing begins when we treat the root causes, not just mask the symptoms with temporary solutions. This is the time to reclaim your health and start a new phase of well-being and vitality. Trust in your body's wisdom and the growing scientific knowledge base that is lighting the way to neural recovery.